Welcome, welcome. My name is Dr. Emma, and today I want to talk to you about something that often goes overlooked, your skin. I've cared for seniors for many years, and one of the most common phrases I hear in my clinic is, "It's probably just dry skin." Whether it's a patch on the shoulder, a flake behind the ear, or a little sore that doesn't seem to heal, the assumption is usually the same. It's nothing. But the truth is, some of those nothings turn out to be something. Every year, thousands of older adults are diagnosed with skin cancer. Most are caught in the early stages, but far too many are ignored because they don't look scary, they don't hurt, and they often start as nothing more than a persistent itch. That's why this video isn't about panic. It's about awareness. Today, I'm going to guide you through 5 specific body areas where itchy or flaky spots could be early warning signs of cancer in seniors, particularly basal cell carcinoma, squamous cell carcinoma, and in rare cases, melanoma. I'll show you what to look for, how to check yourself gently when to speak to your doctor, and most importantly, how to tell the difference between an itch that's harmless and one that deserves your attention. Because when skin cancer is caught early, treatment is simple, safe, and highly effective. But when it's ignored, it can quietly grow deeper, sometimes even spreading to other parts of the body. So please, stay with me. Let's take care of your skin together, one gentle step at a time. Why skin cancer is overlooked. In older adults, skin cancer is one of the most common types of cancer in seniors, and also one of the most overlooked. Why? Because aging skin already feels different. It becomes drier, thinner, and more sensitive over time. You may notice spots that didn't used to be there, or feel itchier after bathing, or develop flaking that seems harmless. And because these changes are so common, many seniors learn to ignore them. But here's the concern. Certain cancers, especially squamous and basal cell carcinoma, often start in ways that resemble ordinary skin irritation. They might appear as a pinkish spot that flakes, a patch that itches now and then, a sore that seems to heal, then quietly returns in the same place. These signs are subtle, and they're easy to miss. Another reason these cancers go overlooked is because they don't always hurt. Unlike internal cancers that cause noticeable pain or fatigue, skin cancer can sit quietly for weeks or even months before anyone takes a closer look. And because these spots tend to appear on areas we don't always check, like behind the ears, the scalp, or the upper back, they often go unnoticed altogether. Let's also not forget the impact of sun exposure. If you've spent years gardening, walking outdoors, or simply enjoying life without sunscreen, your skin has carried that history. Sun damage builds up over decades, and while you may not feel it anymore, your skin remembers. Lastly, some medications prescribed to seniors, like immunosuppressants, diuretics, or certain blood pressure drugs, can make your skin more vulnerable to damage or reduce your ability to heal from small wounds. It's a perfect recipe for a misdiagnosis. But the good news is this: your skin also gives you early clues. And if you know what to look for, you can catch problems long before they become serious. So let's begin. Here are 5 specific areas I recommend checking closely, because this is where problems tend to hide. Spot number 1, scalp or hairline. Let's start at the top. Literally, the scalp and hairline are 2 of the most commonly ignored areas when it comes to skin checks. And it's not surprising. Most people can't see the top of their own head. And even those who are bald or have thinning hair don't often think to look there. But the scalp receives just as much sun exposure as the face, sometimes more, especially if you've never worn hats or used sunscreen on your head. And when skin cancer appears here, it often presents as a rough, itchy spot that doesn't go away. You may feel it more than you see it. It might flake a little. It might bleed lightly if scratched. You might think it's dandruff or a dry patch of skin from your shampoo. But if it's been there for weeks, that's your signal. Basal cell carcinoma and squamous cell carcinoma often develop on the scalp. They can grow slowly but steadily, and the longer they're ignored, the deeper they grow. Here's what to look for. A pink or red area that feels different than the rest of your scalp, a crusty sore that heals, then reopens again. A shiny bump, or flat patch that feels tender or itchy. If you go to a barber or hairdresser, ask them if they ever notice unusual spots during cuts or styling. Many professionals are happy to point something out discreetly if they think it looks suspicious. You can also ask a family member to gently check the crown, the back of your neck, and the hairline around your ears. If anything feels raised, flaky, or unusual, and it's lasted more than 3 to 4 weeks, make an appointment with your doctor or dermatologist. It's not an overreaction, it's responsible self-care. Spot number 2, upper back or shoulders. Next, let's talk about the upper back and shoulders. These areas are very common sites for skin cancer in seniors, especially those with lighter complexions or a history of sun exposure. Why? Because they're large, exposed, and difficult to monitor on your own. Even if you feel an itch or irritation back there, it's hard to reach. And unless you regularly look in a mirror or ask someone to help, spots can stay hidden for months. Here's what I tell my patients. If you've ever had a sunburn on your back, or if you've spent time outdoors wearing short sleeves or tank tops, you've had sun damage. And where there's sun damage, there's risk. Basal cell carcinoma may show up here as a waxy bump, a pinkish patch, or even a sore that bleeds lightly but doesn't heal fully. Squamous cell carcinoma might appear as a rough, scaly plaque, like dry skin that won't go away. In both cases, the spot may itch, and that's why it gets dismissed. Seniors often assume it's from a scratchy shirt, or dry air, or heat. I once saw a gentleman, 76 years old, who told me, "I've had this dry patch on my shoulder for over a year. It flakes, but lotion helps a little." When we did a biopsy, it was early-stage squamous cell carcinoma. We treated it easily. But if he had waited another year, surgery might have been more complex. That's the value of paying attention. If you notice an area on your back or shoulders that feels rough, itchy, or different, and especially if it changes over time, take a photo. Ask a loved one to help. And please have it checked. Spot number 3, lower legs and calves. Your lower legs and calves are often exposed, especially in warmer weather. And they're an area where many seniors feel dryness, irritation, or even swelling. But persistent itchy spots in this region shouldn't always be blamed on circulation or dryness, especially if they don't respond to creams or moisturizers. Basal cell carcinoma is common on the lower legs. So is squamous cell carcinoma, particularly in fair-skinned individuals. And melanoma, though rarer, has also been known to appear in this region. These cancers might appear as flat patches of irritated skin shiny or waxy-looking bumps pink or red, sores that flake or crust spots that itch in the same place again and again. And here's something important. Just because something looks small doesn't mean it's harmless. Some of the most dangerous skin cancers begin as the tiniest changes in texture. I had a patient named Margaret, age 69, who had what she called a dry ankle patch for 6 months. She tried every lotion she could find, but when we examined it closely, it had changed shape, and that change was key. A biopsy confirmed squamous cell carcinoma. Thankfully, it hadn't spread. What saved her? She paid attention. When the lotion stopped helping, she didn't just ignore it. She asked for help. You can do the same. If you've been moisturizing a patch for weeks with no improvement, or if an itchy area starts to feel different under your fingers, get it checked. It's a simple step that could save you from something much more serious down the road. Spot number 4, chest and neck. The chest and neck are among the most sun-exposed parts of the body. And because many people wear open neck shirts or V-necks, these areas often go unprotected for years. What makes them tricky is how easy it is to dismiss discomfort here. Some women assume it's caused by necklaces or bra straps. Men often ignore. itching on the neck entirely. And because this area doesn't typically hurt, people rarely take a second look, but that's exactly where skin cancers can grow silently. What should you look for? Rough patches that don't flake off pink, or red areas that itch repeatedly, sores that bleed slightly and return in the same place, shiny bumps or raised spots that feel different from the surrounding skin. I always encourage seniors to check their chest and neck in natural light. The bathroom mirror is fine, but daylight often shows texture changes more clearly. If you see a spot that catches the light differently or feels like it's been there longer than it should, trust your instinct. I once treated a woman named Darlene who had an itchy spot on her upper chest. She said it felt like a shirt tag was always rubbing, but when we examined it, the skin was slightly raised and crusted. A biopsy confirmed basal cell carcinoma, and we were able to remove it with minimal scarring. That's the beauty of early detection. So the next time you're getting dressed or moisturizing, take an extra moment to look at your chest and neck. You know your skin best. If something doesn't seem right, act on it. Spot number 5. Ears and behind the ears. Last but not least, let's talk about the ears. This is one of the most sun-damaged parts of the body and also one of the least checked. Why? Because it's behind us. Out of sight, out of mind. But the ears, especially the tops, edges, and creases, are a very common site for squamous cell carcinoma. If you wear glasses, hearing aids, or even hats with tight straps, any discomfort behind the ears may be written off as friction. But don't ignore repeated irritation in this area. Skin cancer here often appears as crusty or flaky patches, a sore that heals, then reopens, an itchy bump or growth along the edge of the ear, scabbing that doesn't disappear. One of my patients, Harold, came in for a hearing aid adjustment. During the visit, I noticed a rough patch behind his left ear. He hadn't even felt it, but it was visible under good lighting. We biopsied it, and it was early-stage squamous cell carcinoma. I had no symptoms, just a hidden problem. And that's the pattern I see too often. No pain, no bleeding, just a patch that stayed a little too long. If you feel anything unusual on or around your ears, especially if it itches or returns in the same spot, please ask someone to help you check. These cancers are often very treatable when caught early. So, what to do if you find a spot? If you've noticed a spot that matches what we've talked about, don't panic. Most skin cancers grow slowly, and they're highly curable when found in the early stages. Here's what I recommend. First, take a photo of the spot. Use good lighting and include a ruler or coin for size comparison. This will help you track changes over time. Second, write down the date you noticed it. Jot a few notes. Itchy, flaky, pink, crusted, etc. You can also note whether it bleeds, oozes, or changes after scratching. Third, resist the urge to diagnose it yourself. Instead, make an appointment with your primary care doctor or dermatologist. Even if the spot turns out to be benign, you'll have peace of mind, and that's worth everything. If you're worried about bothering your doctor with nothing, please let me reassure you. Checking your skin is not a bother. It's one of the most responsible things you can do. Many clinics even offer total body skin exams, where trained eyes can catch things we might miss in a mirror. And if your doctor does recommend a biopsy, don't be afraid. It's a quick, nearly painless procedure, and often it's the first step to complete healing. Let's gently review what we've learned today. There are 5 areas where skin cancer can quietly begin, often disguised as an itchy patch or flaking spot. Your scalp and hairline, hidden under hair, easily ignored. Your upper back and shoulders, sun exposed and hard to see. Your lower legs and calves, often mistaken for dry skin. Your chest and neck, high risk, often overlooked. And your ears and behind the ears, where tiny irritations can grow unnoticed. If any spot in these areas is itchy, crusted, slow to heal, or keeps returning, it deserves a second look. And if you're not sure what's normal and what's not, that's okay. None of us are born with skin cancer knowledge. That's what your doctor is for. What matters is that you care enough to check, because your skin tells the story of where you've been, and it deserves to be cared for as you move forward. Thank you for spending this time with me today. I know this was a serious topic, but it's one that can quietly protect your health, your comfort, and your confidence. The truth is, your skin still heals, your body still responds, and with just a little awareness, you can stay one step ahead of problems that others might miss. So take a moment today, look closely, ask for help if you need it. And if something feels off, speak up. You're not overreacting. You're listening to your body, and that's a powerful thing. If this video gave you clarity or reassurance, consider subscribing to Aging Well with Dr. Emma. I'm here each week to walk with you through the health changes that matter most after 60. Take care of yourself, and I'll see you in the next video.